aging is a progressive process. All of us know that our parents, mothers, fathers, and other family members will eventually grow old and face inevitable health challenge. As we age over 65, we tend to suffer from several conditions. My name is Dr. Grandoit, family practice, holistic practitioners. I work many years during my practice with elderly patients, hospital, as well as in my private practice. Archbishop Desmond Tutu said in one of his speeches, I want to tell the world that I count, that other people everywhere count, that people all of age should be included in the Sustainable Development Goal. Today, I want to tell all of you who are watching, I want to tackle elderly disease who have been forgotten and ignored. High blood pressure constipations. I know many of you who are watching me tonight may say, what this man is talking about. There is no such thing as high blood pressure constipations. All of us in this room and beyond are aging. We all want to age well, in safety and with dignity. If we do so, we want the same for our elderly, our grandmother, grandfather, mother, and father, who have sacrificed all their life to taking care of us and expect us to do the same when they get older. To understand what is high blood pressure constipation, you must understand high blood pressure. What is high blood pressure? The force of your blood pushing against the wall of your blood vessel is constantly too high. If you forget, let's do a little revision. This blood pressure is the result of two forces. The first force, systolic pressure, which is the top one, your heart pump. The second force is the diastolic pressure, the bottom number where the heart relaxes. The only way to know if you have high blood pressure is to have your blood pressure tested. Normal blood pressure is less than 120 over 80 milligrams of mercury. If you are an adult and your blood pressure is constantly at or above 130 over 80, you may have high blood pressure. If the blood pressure constantly ranges at 140 over 90 milligrams of mercury or higher, you have high blood pressure, hypertension. So your doctor are likely to prescribe a combination of blood pressure medication and lifestyle change. If your pressure reading suddenly exceed 180 over 120 milligrams of mercury, is a sign you may experience an hypertensive crisis, which could be a sign of possible organ damage. Why is so important to know if you have high blood pressure? Early detections of high blood pressure is very important because high blood pressure is a silent killer. He has no symptom. Today, I'm going to tackle elderly disease which remain silent killer nobody talk about, who is affected and killing our elderly population. High blood pressure constipations. What is high blood pressure constipation? Let's tackle that with me. Chronic constipation is infrequent bowel movement of difficult passage of stool that persists for several weeks or longer. We know constipation is a problem that causes discomfort and frustration. That go beyond mild to moderate measles. In fact, straining and forcing due to constipation has a negative impact on many parts of the body, including the heart. Constipation increases with age and often coexists with cardiovascular factors such as congestive heart failure, arrhythmia, acute coronary disease, and aortic dissection. High blood pressure is often called the silent killer. Most people who have it don't have any symptom, and that silence can be deadly. Therefore, high blood pressure constipation is called also the silent killer. Our elderly don't have any symptom, and that silence can be deadly for them. High blood pressure constipation can lead to our elderly of serious problems, including heart attack, heart failure, and stroke. Cardiovascular medical researchers focus on more dramatic intervention. The risk for constipation in elderly is overlooked. For them, does not exist. Physicians caring for patients with cardiovascular disease should acknowledge constipation and straining, which is an important cardiovascular risk for our elderly patients. Constipation has been reported to be linked to the occurrence of cardiovascular event in elderly. Another study also showed the link between constipation and cardiovascular event might involve a change in intestinal microbiota. You remember when I talk about 2-3 weeks, I stay and talk about prebiotic, probiotic. I'll come to that later. Many papers have been reported on the association between change in the intestinal microbiota and increased blood pressure as a progression of atherosclerosis cardiovascular disease. Even oxidative stress, another link between constipation and cardiovascular disease on elderly patients. They even see obesity. People with a body mass BMI of 3.0 or higher more likely to develop high blood pressure constipation. And also risk factor, race, hereditary, gender, advanced age. This is what I'm going to talk about tonight. Advanced age. Asian is the most risk for both constipation and cardiovascular disease in our elderly patients. They see various factors after hospitalizations can also promote constipation, such as decreased activity and environmental change. When the elderly patient go to the hospital, they lay down in bed, no activity. The environmental change can increase the risk of constipation. And they say for some people, bowel movement means straining and holding their breath. When that happens, patient can cause irregular heartbeat or arrhythmia. This is why I'm talking about high blood pressure constipation. Especially if you have your mother, your father, or your grandmother, your grandfather, you see going to the bathroom. He's straining, holding his breath. That's a movement called Valsalva maneuver. Ask your doctor, what is it? And that can cause the poor patients having an irregular heartbeat. The heartbeat fast and cause them to have something called supraventricular tachycardia. And when that happens, that's a problem with the heart electrical signal of the heart of the patient. Some people say it's not a serious problem, but for me, I say yes, it's a serious problem. These combinations of straining, holding her breath, and now the body is in a panic mode. And when the body is in panic mode, it creates a rise in the blood pressure with an irregular heartbeat. And the patient may be faint. If that patient faint, we call it vasovagal syncope. And that can be deadly for that patient. Especially if the elderly has a chronic constipation, cannot pass the stool. That could induce mental stress and may cause rise in the blood pressure. The Valsalva maneuver is a breathing method that makes slow down your heart when it's beating too fast. If you have that kind of problem, please tell your doctor so he can instruct you how to do. He could suggest you the Valsalva maneuver. If you have a type of fast heart rate called supraventricular tachycardia. If the heart beats fast, you go to the bathroom, you strain and you hold your breath, and your heart beats fast. That's supraventricular tachycardia. And this is a problem with your heart electrical signal. If you see your mother, your father, your grandmother, your grandfather go to the bathroom, he's straining hard, and he hold on his breath. He can't breathe. Call 911 fast because she's getting into a supraventricular tachycardia, the heart fast. That could be a dangerous for your mother. There is things they can do for you at the hospital, for your heart electrical system to relax. They can relax it with medications, or if they cannot do it with medication, they could do something called a catheter ablation. Despite this fact, there have been a few reports about the association between defecation and elevated blood pressure. Despite all this fact, nobody talk about our elderly. They ignore. It's like they don't exist. They die from old age. Yeah, from old age. There have been only a few reports about this, the association between defecation and elevated blood pressure. Medical cardiology expert still ignore this is a serious problem for our elderly population. For example, elderly patient blood pressure surge perform strain at the stool early in the morning in a cool bathroom in the winter. The blood pressure may undergo an exaggerated increase. If you have your mother, your grandmother, your grandfather, your father, in the morning, he's in the cool place, you see blood pressure rise. Stabilize the temperature for him or her. Check his blood pressure. If he's going to the bathroom, you see him straining, hold his breath. Check his blood pressure. His blood pressure high, because high blood pressure constipation is also the same way as high blood pressure is a silent killer. High blood pressure constipation is also a silent killer. They may say some hypertensive patients also exhibit morning blood pressure surge early in the morning. Change in room temperature often includes blood pressure surge. They say especially on our elderly patients. There was an article by the National Center for Biotechnology Information. Constipation causes high blood pressure. It's not me saying it. This is due to the growth of bacteria in the gut, which increase the risk for atherosclerosis, which causes high blood pressure. Remember I talked about probiotics. Probiotic can help good bacteria in the gut. Patients with cardiovascular disease, especially when complicated with heart failure, they are instructed to restrict their water intake and are often administered diuretic, which can promote constipation. So when you see the doctor give your mother diuretics, make sure that he go to the bathroom. He's not constipated. According to the article published by the National Center for Biological Information, antihypertensive drug affects smooth muscle contraction, cause slow digestion and less frequent bowel movement. The article also mentioned that iron supplementation also causes constipation, which is an important factor to note, as iron deficiency anemia is common in the elderly patients. Let me tell you. During my years in geriatric medicine, I have treated patients whose case indicated the possibility of an association between constipation and cardiovascular event. You out there, listen to me. If you have your grandmother, your mother, your father, your grandfather went to the bathroom, you see straining, holding his breath. Even if he's not holding his breath, he tell you he has back pain. Why he's straining, going to release his stool. That poor patient is experiencing heart attack, myocardial infarction, call 911 stat. How can we manage high blood pressure constipation with our elderly who has cardiovascular disease? To some experts, there is a link between constipation and the management of high blood pressure. As a first step in the management of elderly patients who have high blood pressure constipation, physicians should intervene in the lifestyle of this patient. Your doctor should also know if this patient has constipation or not, how this patient is doing or not only medication. You out there, if you're taking care of any elderly patients, or you have any elderly patients, allow them to have adequate time to defecate it. In addition, try to see if they can take at least 20 to 35 grams per day of dietary fiber and 1.5 to 0.0 liter of water per day intake, because it's necessary for the poor patient for ideal defecation, for the patient to go to the bathroom and release his stool without no problem. But the biggest problem we have, this is why I talk about high blood pressure, constipation. My experience telling me we are ignore what's going on with our elderly patient, because all of us forgot one day we're going to be there. We will be there. So we all going to be there. There was 2 patients who asked me questions that I promised them I will answer in the air. The first question was, I am taking oral iron with antacid. I always have constipation. And on the top, I'm taking atenolol and lisinopril. I confront my doctor. He ordered Colace for me. And I still have constipation. My blood pressure remains high. And there is time it goes 180 over 110. Well, what can I say about this question? Constipation is a problem that causes discomfort and frustrations and nuisance. Remember when I say constipation is not a disease, it's more a symptom. Like high blood pressure is not a disease, it's more a symptom. Therefore, high blood pressure constipation is not a disease, it's more of a symptom. All iron supplementation frequently causes constipation, and an important factor to note, iron deficiency anemia is common in the elderly. That's why your doctor puts you on iron. If you cannot take the whole iron, it is best to ask your doctor if he can switch supplementation, may be recommended. That depends to your doctor. And also, ask your doctor if he can put you on vitamin C taken with the iron. And do not take the iron after you finish to eat. Always take the iron before you eat. Aluminum-containing drugs such as sucralfate and antacid can cause constipation. And this drug may be replaced by additional laxative proton inhibitor. Ask your doctor if he can change the medication he gives you for constipation to another form of proton inhibitors, if that's what your doctor chooses to do. The underlying cause can also be a serious disease that requires medical evaluation. To see your own doctor if you don't have high blood pressure constipation, which is often ignored by your own doctor. According to the article published by the National Center for Biotechnology Information, antihypertensive drugs, like what your doctor put you on, calcium channel blocker, is one of the major class antihypertensive drugs promote constipation due to their suppression of smooth muscle movement. If you have heart failure, which I don't know, according to the question you asked me, ask your doctor to be evaluated for you, the medication he gives you for your diuretics. I hope I answered the question for you. If there is no bowel movement for at least 3 consecutive days and the stool is hard, some experts also call constipation. Chronic hypertension constipation should never be taken lightly. It can seriously damage the health of your heart. How can you help yourself from high blood pressure constipation? As I told before, treatment of high blood pressure often starts with lifestyle change, including you decreasing salt in your diet, losing weight if necessary, stopping smoking, cutting down on alcohol use, and regular exercise. In addition to life change, medication are often used to lower blood pressure, with each type of medication having benefit and risk that should be carefully weighed by you and your doctor, your healthcare provider. Please, controlling blood pressure and the constipation of your mother and your father, elderly, should be a part of a healthy living plan and a lifelong task. Our mother and our father spend all their time to take care of us. Now they are old. This is our obligation to take care of them. You must know if your mother is constipated or not. You must go to your doctor with your mother and ask him, did you know the lifestyle change of your mother? Not because she is an elderly, she is forgotten. By taking charge of the health of your elderly patients, you can control the silent killer that I call high blood pressure constipation. In addition, there was a research done, a preview human clinical trial. From the metaphysics analysis, the result of the study showed that consumption of probiotics may improve blood pressure constipation. You see? In addition, take a closer look at your diet. Drink plenty of water and increase fiber content. Make your grandmother, your grandfather do a little walk, because walk can invigorate core muscles and encourage the intestine to move the waste along. So if you like herbs, please, why not? If you plan to use herb as a natural remedy to lower your blood pressure, you should also check for the integration with the current medication you are taking. Please, I always tell people, do not take any natural remedy without consult your doctor. Finally, what is the most important of my lecture? The bathroom environment is important. If your grandmother, your grandfather, your mother, your father, elderly, going to the bathroom, and the room temperature of the bathroom and the temperature of the toilet seat is very important, because there was research done. Environment factor can increase your grandmother, your mother blood pressure, causes heart beat fast. Remember, supraventricular tachycardia can give him a MI, myocardial infarction, heart attack, and die. If he's straining, hold his breath, room temperature can affect it. This is all about my lecture. Constipation, high blood pressure, constipation. So please, get knowledge about what you want to do for your elderly patients. So be smart. Read, research, and then decide. You must not rely solely on the information I gave you or any other place as an alternative medical advice from your doctor or other professional healthcare provider. You should never discontinue medical treatment because of information. Always consult your doctor or other professional healthcare. Remember what I tell you, controlling high blood pressure constipations is more important. Your doctor should be a part in the living life of your elderly patients. High blood pressure constipation is one of the risks of cardiovascular disease, and patients with cardiovascular disease tend to be constipated. Therefore, high blood pressure constipations put them at risk to develop myocardial infarction, heart attack, and die. And when the poor patient dies, it's not because, he has high blood pressure, he has diabetic, he has this, that's why he died. No, that poor patient can live more longer if we take care of it, because high blood pressure constipation is also a silent killer. All of you who are watching me, we all going to be there one day. We're going to be an elderly. I told you from the beginning when I started this show. So you see, we all going to be there. With age, our ability to fight disease decrease. We can't fight it anymore. So it's not only the doctor. All of us should be able to care for our elderly patients. So I want to tell the world that my grandfather, my grandmother, my mother, and my father always count, as well yours. Every one of them count. We should not ignore what's killing them. What the silent killer is, high blood pressure constipation. All the research, they tell you, cardiovascular physician expert, ignore high blood pressure constipation. They said physician caring for patients with cardiovascular disease especially the elderly, should acknowledge high blood pressure constipation is an important cardiovascular risk and intervene to prevent it. This is what I have for you tonight. If you like our show, tell your family and friends to watch us. Please subscribe and let us know. Thank you, and bye-bye.